Welcome back to another episode of the Healthy Chicago podcast. I am your host, Star Cervantes, your antibiotic stewardship pharmacist, or as I would like to say or call myself, the antibiotic stewardship educator for the city of Chicago at the Chicago Department of Public Health. And today is National Penicillin Day. And this day was established to raise awareness on the impact of being labeled allergic to penicillin. And we actually have a very special guest today. I would like to introduce to you Dr. Ruchi Singla. She's a board-certified allergist-immunologist from the University of Chicago who has a special interest in drug allergies. So welcome to the podcast, Dr. Singla.
Thanks, Star. Thank you for the introduction.
Yes, of course. We're so happy to have you. I know this is something that we've been working on for quite some time, and I'm glad that we're able to do this today and talk about a little bit more of what you do. But I just wanted to get some background information for everybody so that they kind of understand what we're celebrating today. But Penicillin Allergy Awareness Day, just to kind of give some background on that, penicillin was discovered actually by a scientist called Alexander Fleming, for those of you who may be familiar with this name. So this is back in 1928 when they made the first antibiotic, and it actually happened by accident in their lab. And it wasn't actually until the 1940s where it started to be marketed more and produced in larger quantities, and was actually used during World War II to treat soldiers and their infections. So this actually was a breakthrough and marketed as the first antibiotic out to market, and hence the beginning of the antibiotic era. So although penicillin, as we know, is one of the first antibiotics, it's very still common use today in practice, and actually the preferred treatment for a lot of our infections today that we'll talk about a little bit more on our podcast today episode. But Dr. Singla, can you tell us a little bit more about your training and how you kind of became interested in antimicrobial stewardship, or as we would say, antibiotic stewardship and antibiotic allergies specifically?
Sure. So I am, like you mentioned, an allergist-immunologist, and I focus on helping people, both adults and kids, with allergies to things like foods, environmental triggers, and medications. And I became interested actually in antimicrobial stewardship because penicillin is such a wonderful medication, yet so many people carry this allergy label, and most of them are not actually accurate. And I found that by clarifying these allergies, we're able to give people the most safe and effective medications. And like you mentioned, this is antimicrobial stewardship to work, right? Is making sure that people are getting the right medication and that we're preventing antibiotic resistance, or basically the efficacy of these drugs in the long term.
Yeah, and that's something that's really important that I know we talked about in our calls before, but also just wanted to reiterate for the public too. If you guys have listened to our previous podcast episodes on what antimicrobial stewardship is and what we're talking about, it's basically making sure that you're using the right duration, the right drug, the right dose, the right duration is what we call the 5Ds, for the right diagnosis and I'm missing one. Drug, duration, dose. I always do them in order. Diagnosis and de-escalating is the big one. So that's the last one where we want to make sure that we are narrowing down therapy to the right agent, or what we call the right antibiotic. So just some brief background on that if you've or weren't really familiar with that. But something that we wanted to talk about was penicillin, which is one of our antibiotics. And we know that about 1 in 10 people usually report a penicillin allergy, but studies also show that over 90% of those patients that are reporting these allergies aren't truly allergic. Can you tell us a little bit more, Dr. Singh, about why is that?
Sure. So, one of the things is that I think a common misconception is that antibiotic allergies are common. They're actually not common. So, an allergy means that your immune system basically sounds an alarm when you're exposed to something that it is mistakenly thinking as harmful. And that sets off reactions like hives, swelling, or difficulty breathing. And most of the time, people don't actually have those kinds of reactions. They may have common side effects like diarrhea or stomach upset, but these are not allergies and they're not contraindications to taking those medications. So that's one thing, is that they're not common. Secondly, most of the time people get labeled with penicillin allergies when they're in childhood. And we know that rashes are very commonly associated with childhood infections. And oftentimes those rashes get mistaken as allergies. So I like to say that not all that rashes is allergic.
Yeah.
And these side effects often are mistaken as allergies, like I mentioned. And then finally, allergies can actually go away over time. So we found that 80% of people who may have been allergic actually can lose that sensitivity after 10 years. So it's worth getting checked to see if you actually are allergic.
Interesting. Yeah. That's something that I think is really important for the public to understand, and that the rashes that, I mean, I didn't know that if the rash was, we had it as a child, that it could potentially be something that goes away in time. But so if somebody has a rash specifically in their childhood after taking penicillin, how would we classify that? Would they specifically mean that they are allergic, or does that mean something else?
Yeah, it can be tricky, and I think this is why that people get labeled. And oftentimes, I'd say most oftentimes, when we see rashes during infections, it's because of the infection. So viruses are notorious for causing rashes, for example. But it can be tough to sort out, which is why it's worth talking to a professional to figure it out.
Yeah. And that's a good segue into my next question on what can we do, or why should people care about clearing this up? So if somebody avoids penicillin, I know a lot of the times we had patients coming in and just saying, like, I'm just gonna not take it because I'm not sure if I'm allergic to it or not. Um, and it might just be safer for them just to stay away. So can you talk a little bit more about that and kind of address those concerns that the public may have?
Sure. I think, it seems counterintuitive to say if you're allergic, you should try it. But again, most people are not actually allergic. So why does that even matter? Like you said, can't I just stay away from it? And we've kind of alluded to some of this, but penicillin is still a really, really great antibiotic.
Mhm.
And if you're not able to take penicillin, you're often given maybe stronger or broader antibiotics that can cause other side effects, things like C. diff, we've seen MRSA, those as a direct consequence of avoiding penicillin. We've also seen increased rates of surgical site infections with patients who avoid penicillin. And then we've talked about, antibiotic resistance. So the concern is that if we keep staying away from these medications, we might make them not as effective. So I think it's important not just on an individual level, but for everybody, that we address this, basically a public health issue.
Right. Yeah. And as we know, and we have been tracking here, like the resistance to these antibiotics has been trending upwards. So we have been seeing a lot more of that. And I like the point that you made about having less options, and that's something that definitely we want to talk about and inform everybody on the potential options that we do currently have, and how talking about your penicillin allergy and getting that clarified or delabeled, as what we call it, is important. So what are some things that people can do if they've been labeled allergic, but they aren't really sure if it's true?
I suggest starting with your primary care doctor and seeing if they think it's worthwhile to see an allergist. If you are interested in seeing a local allergist, a great website to help you find a local board certified allergist is the American Academy of Allergy, Asthma, and Immunology. And I think we can include the link in the show notes.
Mhm.
Uh, and one thing that's a common misconception is that if you had a family history of a penicillin allergy, say your mom or dad had it, that you should be avoiding it. And actually, we haven't really shown that there's a genetic association there. So if you've never tried it, you should try it. So you can actually just delabel yourself and try the medication.
Yeah, that's a good point. I feel like I have that a lot in my family because I have family members that are reported allergic to penicillin, but they had something when they were younger and they kind of afraid to try it now. But like we talked about, it's kind of, there are solutions out there that we can kind of look at, and starting with your primary care to kind of get those delabeled. So that's something I'm definitely going to bring back to them and get them checked out. But another question too is, what kind of tests do they do for allergies? How do they figure out what you can do to see if you are not truly allergic?
Yeah. So the people that we kind of consider to be low risk for having an allergy are what we've already mentioned, having a rash, or if it's been a long time ago that it happened. And the gold standard to rule out a drug allergy is what we call a drug challenge. So we actually give the medication, usually orally, in small increasing doses, typically starting with a test dose, and we monitor for reactions. So that's done in usually a clinic setting, so it doesn't have to be in the hospital. It can actually be in an outpatient setting. And if you don't have any reactions during that challenge, that rules out an allergy. Now, there are patients who, if they have a more severe history, say they had a severe allergic reaction, what's called anaphylaxis, and they wound up in the hospital, for example, that's when we recommend doing skin testing. So we can actually skin test to the components of penicillin. And if somebody is negative to that skin test, we still follow it up with a challenge to make sure that they can tolerate the medication. And then there are some very rare reactions that we don't have testing for quite yet that's standardized, but I think it's coming. But an allergist can kind of help sort out what is the most appropriate testing for you, if any.
Yeah, that's awesome. I'm definitely going to look into that and mention that to my family members who I think would benefit from that for sure. Thank you for sharing. Okay, we're going to switch things up a little bit and do something a little bit different. We have a quick rapid fire of common myths that we have heard, and we want to talk about and see if you can tell me if they're true or false and why. So I'll say a statement and then we'll kind of go from there. So,
Fire away.
one of the common ones, the top one, a penicillin allergy lasts forever.
False. So many, many, many people lose this sensitivity over time.
Yeah, and I think you touched on that. Especially one of the things I wanted to highlight was the having a history of it and kind of, not being sure if that's actually truly an allergy from before. I know we see that I saw that a lot when I was in practice, and it's something definitely that I hope now the public can kind of go and look into that with their providers, and now that they have these resources that we're going to be providing for them today. Cool. All right, next one. If a patient is allergic, their child would be too.
False. So there's no genetic association there. So if you don't have a family, or I'm sorry, if you don't have a personal history of an allergy, then you should try the medication and see how you react to it and not base it on relatives.
Yeah, and I think that's a great point too, because it like we talked about earlier, you're limiting your options to potential antibiotics that we can be using. And like we said, penicillin is one of the first ones, but it is also still commonly used a lot today and can treat some of the minor infections that we have. So it's better to kind of have those options and have limited options later. So definitely would suggest people looking into those if they have had one before. So the next one, if I had a reaction 20 years ago, I would still avoid penicillin, or I should still avoid penicillin.
Like we mentioned before, false, or I should say likely false,
Yeah,
because there are people that may still keep this allergy label. And I don't want to make light that there aren't, there are people, of course, who are allergic. But the good thing
right.
is that the immune system kind of forgets over time.
Yeah,
So it's worthwhile to check.
right. And we won't know until we try. So it's we doing the challenges like you mentioned, or the drug challenges, the drug testing. Those would be really beneficial to kind of weed those out and identify if it's a true allergy or if it's something that is can now be tolerated by the patient. Yeah. Thank you. Okay, last one. All reactions to antibiotics means you're allergic.
False. So, unfortunately, most reactions don't actually fall under those immune mediated or immune system warning signs. So most reactions are not actually allergies.
Yeah. All right. I like that. Thank you. Okay. Well, that was great. Thank you for letting me pick your brain today. I definitely learned a lot, and I know our listeners did too. Is there any key final messages or that you would want the listeners to remember about penicillin allergies specifically?
Thank you so much for having me. And I know you share my passion for this topic. So I think it's fantastic that we're able to bring it to people, especially to commemorate National Penicillin Allergy Awareness Day. And I think hopefully my take home message here is if you think you're allergic, you're probably not. So get checked out.
Yeah, it doesn't hurt. There's a lot of options, and we'll link some of those resources down in the show notes that Dr. Singla mentioned. But thank you for joining us. Again, that is all we have for today. Thank you, Dr. Singla. I hope everybody can take something from our conversation today. And for more information on penicillin allergies, please see the links provided below and make sure to subscribe to our channel for more episodes. Until next time, Chicago, thank you.